One type of common problem with patellofemoral pain syndrome are the patellar subluxations. Patellas most commonly track laterally, primarily due to the Q angle. However, people with this problem may find that they have dynamic valgus malalignments, they have the altered patellofemoral joint compression, they have decreased force production, and they have a dysplacious femoral condyle. Signs and symptoms of a subluxation include the sensation of a knee giving out, having peri or retropatellar pain, noticing pain with closed kinetic chain, and having single leg squat difficulties. There will be a decreased active range of motion for knee flexion due to guarding mechanism that prevents the increased quadriceps demand. Special tests that will be used for patellar subluxations include both static and dynamic tests. The static test is an apprehension test. Apprehension test is exactly what it sounds like, in that you are pushing the patella laterally and looking at the person's face to see if they get apprehensive, as if they're afraid that it's going to sublux again. There's also dynamic tests. The moving patellar apprehension test is done similarly to the apprehension test, except the person is also having their knee extended while the patella is being pushed laterally. When diagnosing, the apprehension patellar test does have low sensitivity for the diagnosis of patellofemoral syndromes. Having someone go in for a radiological sunrise-sunset view, they may be able to notice malalignment or maltracking instability, a fracture may be seen, or a bone bruise of the vertical ridge of the patella and or lateral femoral condyle. Treatment is going to generally be conservative, correcting the underlying etiology, strengthening medial structures, lengthening the lateral structures, performing McConnell taping, as well as patellar bracing may be used. Surgical treatment may also occur, and that can be either the reconstruction of the medial patellofemoral ligament or having a lateral release performed.